Hey everyone, this is Sarah Caudle. I am in group 2 for the debate on the use of omega-3 fatty acids in the treatment of dyslipidemia, hypertension, and diabetes. So I will be providing information that does not support the use of this supplement in treatment. So I'll get started here with a little bit of background information. The University of Maryland Medical Center states that omega-3 fatty acids are essential for human function, and they're found in a lot of our dietary sources, which include fish, vegetables and fruits, and certain nuts, and they've become popular because of the believed risk reduction for various cardiovascular diseases, including hypertension and DLE, and stroke and certain cancers. And they also are reported to improve brain function. All of that being said, there are various precautions that are recommended or that are known about that supplement. And so it's important that each patient seek consult with their physician before starting an omega-3 fatty acid supplement therapy. There's various different types of omega fatty acids found in our dietary sources, and those are called EPA and DHA. I won't attempt to pronounce the long names for those, but those two types are found in our dietary sources, the fish, nuts, fruits, and vegetables. And then the supplement form that you get in the fish oil pills is called ALA. And it's important to know that those come from those different components exist because different patients, depending on their condition, may or may not be able to convert those into the more readily used EPA and DHA form that are found in our natural sources. We'll go ahead and start laying out a few of the major contraindications and precautions for taking an omega-3 supplement. The first of those are the various troublesome or annoying side effects of taking an omega-3 pill, and those include some of the common ones we've all heard: belching, gas, bloating, diarrhea is reported, and a lot of patients have difficulty dealing with that on a day-to-day basis. The next one, and probably the most critical, is the ability of the omega-3 fatty acid to potentiate anticoagulants. So high doses of omega-3s may increase the risk of bleeding in both people that have a bleeding disorder and take an anticoagulant or antiplatelet drug, but it's also showed to increase the bleeding risk in patients that don't have a bleeding disorder or take any of those medications. So this is an especially important consideration for cardiovascular patients. For our diabetic population, those are the specific individuals that may not be able to convert the ALA form, the more unnatural form, into the EPA and DHA form that are found in our natural sources. So that can result in an increased fasting blood glucose and the need for more diabetic or increased dose of your oral diabetics or insulin medications. Next, omega-3s were originally thought to decrease the risk of macular degeneration, but more recent research has actually shown that it can increase the risk, and that all has to do with the ALA form, the supplement form rather than the more natural form. Also, ALA is linked to the increased risk of prostate cancer. And finally, the risk of ingesting contaminants such as heavy metals from various fish forms, dioxins, and other chemicals is a potential risk. There's also several possible interactions with medications that warrant consultation with the doctor, and those are, as we mentioned, blood thinning medications and the diabetic medications. So, in summation, there's not a tremendous amount of evidence out there that supports that this therapy is beneficial. In fact, the AHRQ comparative effectiveness study found that there was little evidence to support that the omega-3 therapy had any effect at all on the various different conditions they were prescribed for: cholesterol, overall MI reduction, diabetes, various different things. So basically what it boils down to is there's not enough evidence to support that this is a good thing or a bad thing, but we do know that omega-3 fatty acids present many risks, especially for our cardiovascular and diabetic populations. So for those reasons, this supplemental therapy should be consulted with the physician before beginning. Thanks, and look forward to the rest of the debate.